Hi, Dr. Brad Miller, Miller Spinal Health and Wellness Center, coming to you for part two of things that we can do for our overall health and dealing with some of the issues with the pandemic that we're in and just life in general. Dr. Rob Landis, I don't even know if I mentioned Good Life Nutrition in the first part. I apologize about that. But Rob Landis from Good Life Nutrition, we work together with patients in some of their nutrition needs. So he is an expert in nutrition and also an expert in exercise. Again, before we get started, a little disclaimer. Some of the things we're going to be talking about in this part is for general health purposes. It's not meant to diagnose or treat any conditions. We ask that you follow up with your medical doctor before implementing any of the things that we talk about today, although it's good stuff. So 60% of America lies in these comorbidities that makes it the pandemic or the virus that we're dealing with right now a serious issue, meaning hospitalization, ventilator, even death. But like we said, these comorbidities, when you look at the stats, it just makes you more prone for overall hospitalization, ventilators, and death. So some of the things we want to do is talk to you about some things that the 60% of Americans that are having some of these comorbidities can implement right now. We've been in this pandemic for a while, but it looks like this is going to be around for a little bit. And it's just good things for you to do for your overall health, so you're with us a lot longer and participating in life at a better level. So today we're going to talk a little bit about exercise. And with all of these issues, Rob and I could go down rabbit holes with you, and we could bore you to death with specific things. So we're talking about just really general things that don't overwhelm you. You can start right now. And if you stay with it, you can start to have tremendous results. Okay, so we know that there's other things. We know that there's other opinions. We know that there's other processes. We know that there's other exercises. We know all of this stuff. Okay, but for today, we're just going to give you a little bite that you can plug in right now. So for overall exercise, some of the research that's coming out is the sedentary lifestyle, sitting at work for long periods of time, 10 hours a day, sitting on your couch for 10 hours a day. This sitting and not moving is more harmful than smoking when we're talking about disease and death and things of that nature. So obviously that's going to be a comorbidity in relationship to this virus as well. So what are some of the things as far as exercise that you would recommend for the people listening that they could implement right now and put into practice?
The first thing is don't get intimidated by the word exercise. We mentioned this in the previous segment. Yard by yard, life is hard. Inch by inch, life's a cinch. And so begin with something simple. And that's what Brad and I were just talking about before, is most of us can walk. And it's a very simple way to accomplish some exercise that is beneficial. Exercise increases the activity of the little Pac-Man in your immune system to go and eat up the bad things. And it also helps your immune system to modulate, meaning that it helps to stimulate response when it needs to be strong and helps to dampen it when your immune system response needs to be less. And so, so basically walking is a great way to do it for most people, Brad.
Yeah, so with the walking, the stats right now are showing that steps, okay, so if you have a pedometer that you can kind of watch your overall steps, you start to see decreased risk of death across the board at 7,000 steps, and then it peaks at about 12,000 steps. So you can get these really, really cheap. You can get online and look for pedometers that you just click on. I mean, all smartphones have this app now. So if you want to check your steps, it's an easy way to do it. It comes out to also about 30 to 40 minutes of walking per day. This also helps with stress levels. And quite frankly, in today's environment, being outside, being in the sun, we're going to talk about vitamin D in one of the upcoming presentations. Being outside, being out of doors away from stagnant air also helps with some of these things with the virus as well. So all these things that we start to do have an accumulative effect on one another, and it starts to build on some. So momentum is momentum, and momentum is either positive or negative. So once we start having some momentum in a positive direction, everything that we start to tell you about starts to move that ball in that positive direction. So little bit at a time, one thing on top of another, and we start to see exponential increases in these processes. Is there anything else that you want just to tell the patients or the people that are listening today about exercise.
Well, just briefly, yeah, we want to encourage you in this because it's been shown in research that the outcomes of people who get a viral infection, and this current pandemic is a virus, that they have less incidence of getting infected, and they have better outcomes when they do get infected when they exercise. And so this can be as simple as parking a little bit further away from the door, taking the steps instead of the elevator. Try to find things to do just to build up into your activity level each day. And it doesn't have to be that difficult to get started with.
Perfect, perfect. Thank you guys so much for listening. Again, if you have any questions, you feel free to contact our office. There'll be a link in this description. Or if you have some nutritional questions, call Rob at Good Life, which there'll also be a number in this description that you can get in touch with him as well. We're going to be coming back next week for part 3, and we're going to be talking about supplementation. So Rob's going to take the reins and give you a lot of information on some things, some little bitty hacks with nutrition that you can do to really increase your chances of dealing with some of these things that are coming down the road. So again, have a great day. We're here to help you. Enjoy the rest of your day. Thank you for watching.